helping us and all the stuff that you guys are doing. I know we got a lot of the board members here who are doing a great job. We have our education commissioner, Stasi Kamoutsis, is with us, as well as Ray Rodriguez, who's the State University chancellor of our #1 rated public state university system. I think we've got it many years in a row now, and I'm proud of that. But I'm most proud of lowest tuition in the nation. I mean, that's what parents really want, right? We also have Kelsey Krebs. She's a nursing student here in St. Pete College. And so one of the things we're obviously going to talk about new money for our nursing initiative. And it's the type of thing where we've stressed workforce education tremendously since I've been governor. There's always a push. When I was growing up, it's like you got to go get that 4-year degree. And I'm not saying some of those degrees aren't good, but there's a lot of students that went a lot in debt at some of these universities around the country and then have some degree in some, obscure subject. And they're not exactly, the C's aren't exactly parting for them when they get out of college. It's just the reality. And a lot of them had debt and they were underemployed. And so, our view is, yeah, you could do traditional 4-year. We want to make sure our students have access to that and can do well. But this workforce education is really important. And that spans a lot. You can get a certification in high school in Florida to do welding or HVAC. And I will tell you, that is in demand. You can come to our state colleges and you can get skills that are very hands-on, but they're advanced skills that are going to have really good application in the real world. And so that was just an insight we had from the beginning. We wanted to improve Florida's commitment to workforce education, and we have done that dramatically. We've had, through all of our education and job training and workforce programs since 2019, $12 billion. Obviously, a lot of our state colleges, which we're proud of, has gone into that, and the results have been very, very positive. But the nursing in particular, so that was something that we had always talked about on a certain extent. But then when COVID hit, you had this massive shortage of healthcare and nurses around the country. So it got to the point where, you'd have like a COVID wave in New York, and then you'd have a COVID wave in the Midwest, and then the Southeast. And it wasn't, it was regional, and it was even seasonal the way it was going. Well, if you have more hospitalizations in one area, you need more people. And then if the nurses are getting infected, then they've got to sit out until they get in. You have all these things happening. So you had a cottage industry of these private nursing companies, I guess, where they would be going, and these nurses were making a lot of money. So yeah, if you're willing to move to San Francisco for the next 3 months, you'll get $30,000 a month or whatever. And yeah, we're going to do that, right? So people were doing that. So it's like this battle to be able to get nurses and to be able to go. So my mother was a nurse for 40 some years. They weren't paying that much money then on these things. And she was very good too. So she would have commanded that. But I mean, it just got to be, it was really crazy. Honestly, a lot of the hospitals are like, we need more people. So that kind of really highlighted the issue, that we had there. So we, partially because of that experience, we've launched programs to be able to do it. So we launched 2 major programs. Our LINE program, Linking Industry to Nursing Education. This program's a competitive dollar-for-dollar matching grant that supports partnerships between educational institutions and healthcare providers. And so the money that is dedicated to that can give scholarships to students who meet requirements, recruit faculty to teach, purchase equipment, and to support simulation centers. You actually see, I was walking in here, I thought it was a real person in that bed. It's a mannequin. I'm like, oh, okay, so you do that. And so we've had that. We've also established the pipeline program, prepping institutions, programs, employers, and learners through incentives for nursing education. And that's to reward performance and excellence amongst our post-secondary nursing programs. So the funds for that go to, are based on the number of nursing education program completers, the first-time National Council for State Board of Nursing Licensing Examination passage rates, and excellence among nursing education programs based on the average of first-time passage rates above the national average. And so both of those have been really good, and that's why we're here today. So I'm proud to announce we can now say that since the inception of the line and pipeline programs in 2022, Florida has invested close to $500 million to support nursing education and address this vital need. But even better, today I'm proud that we are able to award an additional $20 million in line funding, with $14.5 million awarded to state colleges and private post-secondary education, and $6 million to our state universities. And if you look at what we've done in both of these programs, I think we probably are now, just for what we're doing, and I know there's been other things in the private sector, whatever, we're now producing 1,000 plus additional nurses than we were before those every year between our state colleges and our state universities. And so that's a meaningful increase when we were probably, about, what were we, 700 for the, what were we for state colleges?
We were about 4,773, and now we're at over 5,100.
Yeah, so over 5,100, yeah. So, and then the state universities, we've gone up even more on the state universities. And so, and these are different programs, and there's different things you got to do depending on it. But that's an increase, significant increase on a percentage basis, and that's really, really meaningful. And obviously, part of that you just have to do to keep up with population growth and some of the other things that we've seen in Florida. We can also say that more than 85 million has been awarded since 2022 for our line funding, 61.5 million to state colleges and 24 million total to state universities. So that's throughout the inception of the program. So what we're doing, the 20 million this year is a big chunk of that, and that's really, really meaningful for a lot of these programs. Since 2022, 400 million in pipeline funds has been provided to post-secondary education, 240 million for state colleges and districts, and 160 million for state universities. So those are really to address the nationwide nursing shortage. It's very important. St. Pete College partnership has resulted in $340,000 in total anticipated line investments, including $160,000 matched by HCA Florida, $100,000 by Baycare, and $80,000 requested for 25-26 matched by Baycare, Advent Health, and HCA as well. So line funding helps places like St. Pete College better serve working and part-time students, ensuring more Floridians can enter and compete high-demand nursing programs while gaining that hands-on, real-world experience. And look at the results. St. Pete College's National Council licensure examination pass rate for the most recent year we have record was 94.1%. That is much in our overall. That's much better than the overall passage rate in Florida, which is 83%. And so it shows you that at St. Pete College, they're getting the job done, and we really appreciate that. University of South Florida across the bay awarded $23 million through pipeline and line over these years, and they've received $3.6 million awarded through the line program that has been matched in full by community partners, including Johns Hopkins All Children's Hospital, who also donated $1 million on top of those matches. And so we really appreciate their, and honestly, it's in their interest to do this because they need to make sure that they have a qualified workforce, and they don't really want to get involved in these bidding wars where they're having to pay whatever. It really was that 18-month period, I don't know that you've ever seen anything like that. That was a really big, so they want stability. They want to make sure that they hire good people, that they can be there and not constantly have employees be poached by their places around the country. So it's in their interest to make sure we're producing an adequate supply here. Now, we recently announced our budget that we would have $130 million to support nursing education and workforce initiatives, $100 million for pipeline, and $30 million for line. So the mission continues. We understand the need is there. We understand that we have a growing state. We also have a demographically more advanced state. That's just kind of the nature of it in terms of terms of what we're doing. It's part of the reason why you have so many Hoosiers in Naples and Marco Island, because they work there and then they're able to retire at least part-time in the Sunshine State. And even though it's a little chilly by our standards now, I would not want to trade the weather in Pinellas Park for the weather in Bloomington, Indiana right now. I just think it's likely to be a lot colder. So you see why the appeal is for people to be able to come and be able to do this. So I want to thank the members of the legislature who were involved with launching this. I think we launched it under Wilton Simpson and Chris Sprouse, who both from the Tampa Bay area back during that time, and that was really fantastic that they were able to do it, and we've continued to see success for this. And so, ultimately the results speak for themselves. We're producing more quality nurses. We've got strong performances at places like St. Pete College, and so, you still hear about workforce needs for healthcare. It's not like the issue is totally gone, but I would say the decibel level has been muted from where we were a few years ago, where this was like something that they would always talk about. They have seen some improvement in this because of the efforts that we've been doing here today. So I'm excited for this. I'm excited to award the $20 million, and we look forward to hearing from some of our other speakers. And so why don't we start with our Commissioner of Education.
Well, thank you, Governor, and good morning, St. Pete State College. It's great to be here with President Williams as well as the Board of Trustees. The full board is actually here today, so I'm happy to see them, and congratulations for all those who were recently appointed and reappointed. It's so great to live in the free state of Florida and to have the opportunity to work specifically in the area of education. Week after week, we continue to make announcements that speak to real results, real impacts that students are feeling. Just during the State of the State, a week ago, the governor announced a 92.2% graduation rate in the state of Florida, the highest in our state's history. As we continue to increase our standards, as we continue to attract high-quality teachers, we are seeing that our students are doing better and better. And so any notion that somehow our standards are being watered down is completely false. These students are performing better, and they're being more successful because we are focused on merit and achievement, thanks to this governor. I also want to highlight what an amazing weekend it was in education this week. I was in Orlando, where I got to speak to over 550 students at the Florida Futures Educators of America Conference, where you had students in high school who are aspiring teachers that want to go and give back to their communities and have such a significant impact. And so it was great to talk to those students. And we also hosted our National Civics and Debate competition, the Great Debate, that was championed by this governor, where we had hundreds of students. This was a program that started with just 11 school districts years ago, but thanks to this governor, we have pushed so that all 67 districts are participating, and you had 15 states from across the country that flew students in to be able to participate in that civics and debate competition. So I was happy to be able to participate in that this weekend, and it's just great to be in Florida when it comes to education and so many other things. So today's announcement is yet another thing that we're able to tout where there are significant impacts that are happening across the state. The governor talked about my personal favorite system, the Florida college system. No offense to the university system, Chancellor Rodriguez, but the $14.5 million that is going to benefit those students that come as they are. Everybody knows the Florida college system accepts all students and helps them get on the pathway to prosperity through education. They show value, they show opportunity through education to all kinds of students from different backgrounds and zip codes. And so I'm so thankful that this investment is going specifically towards the nursing programs, to be able to beef up those programs, to be able to give those students an opportunity not just to see value in themselves, but to give back to their communities. And so this investment is going to specifically impact 20 of our 28 state colleges who will receive funding that will reinforce the critical role that our state colleges play as the backbone of Florida's workforce and future nursing of education here in the state. The LINE program, as the governor mentioned, has expanded access and strengthened outcomes by providing scholarships for students, supporting the recruitment of high-quality faculty, as well as providing robust training to these students. And our colleges are clearly maximizing that investment. And in addition, the annual production, as the governor mentioned, has increased nearly 10% in the state college system and even higher in the university system as far as those who are getting across the finish line and graduating in these programs. Florida's nursing students are also delivering results. Just last year, 88% of our registered nursing graduates and 91% of our licensed practical nursing graduates pass their NCLEX exams on the first attempt. That's a big deal. This is a testament to the quality and the rigor of these programs that these students are being exposed to. And so I look forward to continuing strengthening and expanding our nursing programs while also advancing additional workforce pathways that create meaningful opportunities for students and meet Florida's evolving workforce needs. Thank you, and God bless you all.